Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us. Our guest today is Dr. Saibal Kar. He's Director of Interventional Cardiac Research at the Schmidt Heart Institute at Cedars-Sinai in Los Angeles. And he's joining us on the program today to talk about mitral regurgitation and also about how he has performed the first procedure of inserting Abbott's next generation version of the MitraClip heart valve repair device here in the United States. Welcome to the program, Dr. Kar.
Thank you, Howard, and good morning.
Well, you are a cardiologist. Was cardiology your first love in medical school, or did something personal happen to steer you in that direction?
Well, it was my first love in medicine, and I was to some extent steered by my father, who was a famous cardiologist in India. So I did, from a very early age, get interested in the heart, and that's what led me to become a cardiologist.
What is mitral regurgitation, and how is it diagnosed?
In the body, there actually are 4 heart valves, and the 2 most important heart valves are the aortic valve and the mitral valve on the left side. And the mitral valve, what it does is that it prevents blood from the lower chamber to go back to the upper chamber, and allows blood to flow from the lower chamber to the main vessels of the body and allowing blood to flow. What happens is that mitral regurgitation is one of the commonest heart valve problems. And when it starts to leak, blood goes backward into the upper chamber, increasing the pressure in the lungs, and the patients become very short of breath, very fatigued. And if it's left untreated, patients get very short of breath, very fatigued, they get admitted in the hospital several times from heart failure, and ultimately succumb to this if not treated.
So how is this condition treated?
Well, the standard way of treating the patients with severe mitral regurgitation is open heart surgery. But some patients, because of their age or other comorbid conditions or frailty, cannot have open heart surgery. And so one such approach for treating people who cannot have open heart surgery is using this MitraClip, which is owned by Abbott Vascular. It's a very elegant system where the procedure is done in a catheter laboratory under X-ray and echo guidance and on a beating heart. And this catheter is threaded through a small vessel through the groin up to the heart. And while the heart is still beating, we can actually capture the leaflets where it's leaking the most, reduce the leakage, and change the symptoms of the patient instantaneously. Patients usually stay in the hospital just one day and go home the next morning without any incision on the chest.
Now, normally, what would a hospital stay be like? A week, couple of weeks?
Well, if you have open heart surgery in a patient who's not complicated, usually 7 days. But if it's a complicated procedure or the patient's very sick, they're going to go up to weeks and months. But in this patient, even in the sickest patients, they hardly stay more than 2 days and not even in the ICU.
They can basically go home and with very minimal care and supervision begin the road to recovery very
Exactly. That's right.
As you said, these patients that have other comorbid conditions and are not candidates for this type of MitraClip procedure, are they candidates for any type of treatment, or is open heart surgery their last best hope and we hope that they recover?
So you're right. So we have patients, as you say, if they are a low surgical risk patient and their anatomy is suitable, then they undergo open heart surgery. And then you have a category of patients which are high surgical risk and their anatomy is suitable for the clip, they undergo the clip procedure. But the third category is what you were concerned about. Say a patient has a leaking valve and he's high risk for surgery, and then but the clip you think may not work. The options that we can do are either just medical treatment, just palliation. We can try high-risk open heart surgery, or sometimes we can actually try the clip procedure and not necessarily eliminate the leakage, but at least reduce it. And if we can reduce it, that may be good enough for the patient. And that goes to our topic today, that the MitraClip second generation, or this is actually the third generation, which has been just used in the United States, allows us to treat some of these patients which we couldn't do before.
You personally have performed this procedure here in the United States for the first time, is that correct?
That's correct. On 6/30/2018, actually, I did the first procedure.
So you're basically waiting to see exactly how well your brand new patient fares in the recovery process.
Right. Since the approval in the United States, I've done already about 15 or 20 patients, and there are several patients already done around the United States. I happen to be the co-principal investigator of a registry called the Expand Registry, which is prospectively going to analyze these patients treated with this new version of the MitraClip in the US and Europe. And we're collecting data to see how this new clip system improves outcomes compared to the previous generation.
As far as availability and the cost of this new procedure, how does it fare against the second and first generation MitraClips developed by Abbott?
So at the present moment, the new version of the MitraClip is available in selected centers in the United States, and they're slowly expanding it to more centers in the U.S. I don't know the exact number of centers which are starting in the U.S., but it's hopefully by the next few months, it's going to be available all around the U.S. But Abbott is being very careful in their rollout, and they're gradually rolling it out to experienced centers to make sure that there's no untoward effects. The cost of the procedure is exactly the same as the previous version of the MitraClip.
Where can our listeners go online and get some more information about the MitraClip and more about Abbott as well?
So if you actually go to the website, there's a lot of websites on MitraClip itself, or you can go on abbottvascular.com. You can actually see that. And the other option is that in centers like us in the West Coast, like Cedars-Sinai, you can actually go to our website on the Smith Heart Institute, and you can find out more about the procedure, the availability, how to get appointments, how to get treated.
Thank you for joining us this morning, Dr. Saibal Kar, Director of Interventional Cardiac Research at the Smith Heart Institute at Cedars-Sinai. It's been a pleasure speaking with you.
Thank you, Howard.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. Be sure and subscribe to the podcast on iTunes, listen in and download at SoundCloud, and visit our affiliates page at hpr.fm.